Okay. Good morning. Welcome to our second virtual lupus conference of 2026 presented by the California Lupus Foundation. My name is Satara, and I'm a lupus patient and longtime volunteer with the Lupus Foundation in Northern California. I'm excited to be your moderator for today's session. We're excited to welcome each of you to this free lupus health conference. We have a great session planned for today. We want to hear your thoughts on the conference, so please be sure to complete the survey when the webinar ends. This is the only way that we can hear what you liked and any suggestions of what you would like to see in the future. So now I will go over the agenda quickly and then we'll get started. Thank you for your patience today while we got situated. The first hour, we're excited to hear from Dr. Manisha Mittal, an integrative rheumatologist who will be sharing her expertise on living well with lupus, an integrated path to healing and balance. Systematic lupus erythematosus is a complex autoimmune condition that affects the whole person and often requires a more comprehensive approach than immunosuppression alone. In this session, Dr. Mittal will explore how combining evidence-based medical treatments with targeted nutrition, lifestyle optimization, and mind-body practices can help reduce inflammation, prevent flares, and support long-term wellness. After her presentation, we will have 15 minutes of live Q&A. We will be moderating the questions, so please type your questions whenever you want during the presentations. Before we start, I want to remind you that if you have a question, you can type it in the Q&A area at any time. We'll ask them after the presentation is done. We're happy to have Dr. Mittal with us today. She's a double board certified internist and rheumatologist and a leader in holistic medicine. She holds a master's degree in Ayurveda and integrative medicine and serves on the Dean's Advisory Council at California Health Sciences University. Dr. Mittal is the founder of Moksha Holistic Center, author of the children's book series, The Immune Warriors Club, and an advocate for lupus awareness, recognized by the City Council of Fresno. She is also a frequent guest on TV and podcasts and creator of Golden Ice Spiced Turmeric Ice Cream, reflecting her belief that food is medicine. Please welcome Dr. Manisha Mittal.
Thank you very much for such a comprehensive introduction. I am so excited to be here. So, to all the lupus warriors who are participating and those who will be coming on watching the video later on, well, my big kudos to you. This is a brave step that you are part of this conference and you're ready to learn. So, that's the first step, that you want to take charge of your health and you are ready. So, I am looking forward to sharing my slides and showing you some pictures so we can get started. All right. Are you able to see the screen?
Yes.
Yes.
Okay, perfect. And I hope everyone is doing well today. We are getting started. This is such a vital topic, so I'm very thankful and grateful to the Lupus Foundation for really catering to the community needs. Because really living well with lupus is a big, it's a big integrative approach. We do appreciate all that, our physicians do for us. They guide us, they monitor us, but there's a lot that as a patient you can do as well. And it's really good to be acquainted with all the lifestyle modifications that you can do so you're giving your body a best chance to heal. Okay, so why this topic really matters? It matters because lupus affects the whole person. It just does not affect one aspect in the immune system. It really affects the whole personality and the whole person. The symptoms really impact the daily quality of life. Symptoms like fatigue, pain, brain fog, these are all quality of life issues. And this can really impact how you carry yourself day to day, how you take care of yourself, your family, your work. So it has a big impact. And patients have always asked me, is there something else I can do other than taking my medication, coming for a follow-up, checking, getting my labs done? Is there anything else I can do to get myself better? This is a very, very common question that I do get asked in my clinic. And that's exactly what I want to focus the talk on, what you can do yourself to get yourself better. So briefly, what is lupus? And many of you might already be very much aware about lupus, but just to, go through it very briefly, lupus is a chronic autoimmune condition. Well, autoimmune means your immune system is kind of misbehaving. That means it starts to get confused and it's attacking your own body. And it's causing this fever response in the body. There's systemic inflammation. That means the inflammation affects every aspect of the body. All the organ systems can get affected with this chronic inflammation. There's production of antibodies that are directed against your own self, your own tissues. So we call that autoantibody and autoimmune process. And there's injury to different organ systems. The key is how we can, halt this process of autoimmunity, because that's really how you can bring about relief in inflammation and stop the organ damage. Approximately 3.4 million people are affected with lupus, with 90% being women. And lupus affects, different organ systems. So just a picture that shows how it can affect your skin. And you just keep that in mind that even if your skin gets affected, it's a very visible organ. And that does affect how, you carry around and how, the quality of life gets impacted. I have a lot of patients that, even younger or even seniors, that it just matter to them how their skin looks because it's so easy for you to hear from a colleague or a coworker or even at home that, is there something wrong? Your skin looks so red, or why is your skin itchy? So it might sound like a really small thing getting a skin rash, but it has probably a more deeper impact because it affects how we carry ourselves, day-to-day interactions. So these small little things can have big impact on how we conduct ourselves, how our mind is, how our mood is. So everything is kind of related when the condition is chronic. So skin involvement, cardiac involvement, that can be inflammation of the cardiac lining, endocarditis, or even higher risk of heart attacks due to inflammation, and then fluid accumulation around the heart lining. All of those things can affect the heart. Then it can affect your lungs similarly, the pleural lining, getting fluid accumulation or getting inflammation, basic, lung inflammation, then increased risk of getting blood clots in your lungs, kidney involvement. This is really huge because kidney involvement also, puts you at risk of dialysis, and then eventually kidney transplant is needed. So, constitutional symptoms like getting low-grade fevers. A lot of my patients will say it feels like I'm stuck by a bus. I feel so tired, my whole body hurts, there's so much fatigue, I'm not able to function. So, those symptoms are very common and they can be very vague. And that is why lupus is also called the great mimicker. It's so challenging to diagnose it initially because symptoms are very vague. And they can be really a presentation of a simple flu, or it's very difficult to pinpoint exactly its lupus. It sometimes takes time in few years to really get a full-blown picture. Definitely muscle and joint involvement is seen, and involvement in the of the blood, getting low blood counts, anemias, low white cells, changes in the blood pressure. So all of those things in nutshell, and even more. There's neuropsychiatric lupus, which is now really very well recognized. So lots of, symptoms related to memory loss, seizure disorder, or they can be cognitive changes, mood changes, memory loss, brain fog. So all of those symptoms in nutshell can be all part of lupus. Feeling anxious, simple things like anxiety, it's very, very difficult as a rheumatologist for me to just dismiss that as just being just anxious. It could very well be, lupus aggravating the situation. So it's important for, your doctor to hear all your symptoms and for you to also keep a journal where you log your symptoms. That way you can really share those with your rheumatologist, your providers, and they can all put that in together as a perspective in diagnosing and even monitoring your disease. So American Academy of Family Physicians has, as you can see, it's evolved. This is an article that was published there, but you can see over the years, criteria for diagnosing lupus have evolved, and these are more relevant when it comes to categorizing patients in clinical trials. So not necessarily like in day-to-day practice, we need patients to meet all these criteria. But for clinical trials, a lot of these criteria need to be met and they assign certain points. So you'll see, for example, cardiovascular criteria at the top. And at the most right hand of the column, you can see EULAR and ACR guidelines, the European League Against Rheumatism and American College of Rheumatology. 2019, they actually characterize pleural effusion, pericardial effusion, or pericarditis. And there's in parentheses, there are certain points. So they assign certain points, and after a patient meets certain criteria and certain points, they are part of the clinical trial. So this is just a helpful guide to know about symptoms, how lupus can present. Then again, as you can see, fever, a low-grade fever is now part of the criteria, which wasn't necessarily before, but low-grade fever is certainly a way lupus patients can present. Hematologic manifestations in terms of low blood counts, then a lot of immunologic markers, antibodies that we detect in the blood, um, mucosal and integumentary, which includes hair loss, having sores in the mouth, and lupus rash, which can present as a discoid or scarring rash, or just an acute, subacute cutaneous lupus erythematosus, so different kind of skin rash involvement, musculoskeletal involvement with joint swelling, joint pain, arthritis, neuropsychiatric involvement with delirium, psychosis, seizures, renal involvement. So the renal involvement gives, the highest score, 10 points. But these are all part of scoring is part of the clinical criteria, but this is just a rough guide. And in the next slide, this was published in JAMA recently, and this is a little more clear, where we classify lupus. First basis is presence of this ANA antibody or anti-nuclear antibody. A lot of you might have already heard about this, that ANA is the first test even your primary care doctor or your family physician can do for you. And then if that's positive, usually it triggers a referral to a rheumatologist. And the other criteria include clinical criteria and immunologic markers. So at the top, you can see there's different clinical criteria, and we kind of touch based about this constitutional symptoms like fever, the kidney involvement, and the next column, talks about mucocutaneous, the skin rashes, the sores in the mouth, then serosal involvement, which is the lining of the heart and the lungs, hematologic markers having low white cells, low platelets. Now, white cells help fight infection. The platelets are important for clotting of blood and autoimmune hemolytic anemias or having low red cells or being anemic. And so all of these are part of criteria now. Then joint involvement. Usually the joint involvement is not as erosive or as bad as rheumatoid, but joint involvement definitely causes lots of swelling. There's joint effusion, there's morning stiffness, pain, tenderness, and it tends to move around. You could have problems with the hip, then it may move around maybe in a week or two to the shoulder, to the wrist. So there's a lot of, migratory arthritis. Neuropsychiatric involvement is also huge in lupus, where you can have lots of symptoms related to delirium, brain fog, mood changes. There's a fluctuation in these symptoms, psychosis, seizures. So, these are the clinical domains, and then definitely there's immune markers that can be detected in blood. Lupus cannot be solely diagnosed by just, checking some immune markers and not paying attention to the clinical symptoms. And at the same time, when we do assess clinical symptoms, we also check for immune markers. So it goes hand in hand. It's not just exclusive certain lab criteria that we check off. nor do we just go by symptoms. You really have to connect the dots. Although we never dismiss symptoms, personally, I've never dismissed patient symptoms because they can definitely precede clinical immunologic markers. The conventional management that you've definitely heard or is standard of care is through medications that actually help decrease inflammation, and also disease modifying medications that suppress and fine tune our immune system so that it's not attacking our body. So medications like hydroxychloroquine or Plaquenil, steroids, immune suppressing medications like azathioprine, methotrexate, mycophenolate, voclosporin. You might have heard these names. They're very vital to help control our symptoms. Biologic medications like belimumab, anifrolumab or safanello, rituximab, cyclophosphamide, Gazyva. This is a newer medication that is coming on that also works on the CD19/20 mechanism. So there's some newer medications, and there's more excitement in terms of more pharmaceuticals that are coming up for managing lupus. Versus maybe 15 years ago, our choices were very limited, and steroids were still used as the most common modality to manage symptoms. The goals of the management are really to control inflammation and prevent organ damage. So this is very standard of care of managing lupus patients, and it is very important. However, we are aware that when we do follow standard of care, our medications, they do have a lot of side effects. There is definitely side effects, and um, also, there's more that as a patient or as a person you can do for yourself, so you can watch all, inflammation triggers. There's lifestyle changes that you can do so you don't get so much flares of the disease. And that's really where integrative care is important. And that's what I really take pride in sharing with my patients, that there is a lot that we can work together so we can work out through what triggers your disease, what flares up the autoimmune condition, and what you can really do to handle that situation. That way you feel more in control. Rather than the disease driving you, and running your life, you want to take charge. You want to be in charge of knowing that this is what's going to trigger, and this is what really I can do to minimize my chances of flare. And to some extent, this is really true for all autoimmune conditions where we can take charge of our health. Medications are really very vital, and it's very important for you to follow up and establish with a rheumatologist and make sure you are getting monitored for disease activity, to make sure you're not getting organ damage. So those are vital things. But I'm going to talk to you also about how you can address inflammation triggers, lifestyle factors, how do you manage stress and fatigue, and to take charge of this holistically. And that's, I run Moksha Holistic Center. That was really my passion because I always wanted to approach the patient or the person as a whole. I did not want to just focus on the joints or just focus on monitoring certain landmarkers. I felt that that was not complete way of treating a patient, because really we're not hearing the other side. We're not really hearing what the body is telling us. So based on my own personal interest, I went on to train in Ayurveda, which is an Eastern medicine, and really takes into account the whole person. It focuses on mind, body, and soul practices to bring about a balance. And with those principles, I founded the Moksha Holistic Center, and I help patients with autoimmune disease to help bring about a balance. And under the center, we do lots of community engagement, services that we are providing in Central Valley, really focusing on breath work to help manage symptoms of, mind control, meditation, really taking charge of plant-based diet, focusing on food, how, we can develop a friendship with food where really we're not food is not driving the body. It's not necessarily that our whole body runs around food frenetically, but we're using food as source of energy and bringing about balance in the body. So it's kind of a very healthy relationship where you are always in charge and have a balance in mind, body, and soul. And we've been, doing lots of different community engagement practices and activities in our city to bring about more awareness of lupus, especially, and autoimmune disease and arthritis in general. So, lifestyle modification, going along those lines, I will tell you that mind, body, and soul, it's really important to bring about that balance. Once you have that balance, even if you have a chronic condition, be it lupus, you know how to bring about balance. You know when to seek care. You know that even if you have something that's causing organ involvement, you can still not freak out, or you cannot go into a panic attack. You know how to bring about that balance, that you've got this, and how you're going to bring small changes which will eventually lead to long-term solutions. So very important is to change your routine. I cannot stress that enough, that a regular, balanced routine is very vital to any chronic condition. You want to move on from a hush or a rush routine to a more relaxed routine. So, it's nice to have a checklist of things that you want to accomplish during your day-to-day activities, especially if you have a busy family life and you're trying to achieve that work-life balance. It's important to have that checklist, but you also want to journal and keep in mind that you may not be able to get to everything the same day. So you have to learn to prioritize that tasks that need to be done, and the tasks that can wait for the week, and the tasks that have to be done over a month. So that's a really nice way of honoring yourself and telling yourself that I am going to go on to a relaxed, mode. You're going to switch yourself off from that hush hush and that, always running around, that has to change. So that's a big lifestyle change. It's a change in attitude, how you respond to different triggers. And this will be very different in your family members too, siblings, parents, your significant other, children, extended family. You will see that everybody has a personality. So here, what I am trying to tell you is that you will not, circumscribe yourself to a certain personality, that this is who I am. No, you are more able to be more flexible, you're more fluid, you're able to be more adaptive. That is really the attitude you have to take for any chronic condition. You want to be a more relaxed and adaptive personality, and small things will help to bring about that change. I strongly recommend my patients to journal. It's very important that you have somewhere where you can put down your thoughts, how you're making a progress, what happened good in the day and what didn't go so good, and what you want to bring about as a change. Putting down your priority list, like I said, you want to make sure that there are certain things you're going to do really quickly. You have to get to them, and that should be your top priority. Things that can wait and things that can really take time. This is very important for you. That way, that helps you're telling your body and giving your signal, okay, I can have a moment to breathe. This helps with your stress reduction. This definitely makes a difference in how you approach, and then trying to adopt certain principles or practices to get you to that mode, that personality. For example, when we are at home or at work, sometimes people can compartmentalize us that, okay, this is a certain personality. You come into a room, you bring in a certain energy with you. And that is all fine, but you want to make a change. And to help you bring that change, there are certain practices like breath work, meditation. Those are things that'll help you get to those goals, that'll help you become a less stressed person. So, breathing exercises or breath work really works very quickly. When you are a little bit more emotional or stressed because you read a certain email or because you're in a not so pleasant conversation, regardless of, who's right or wrong. You may be right when trying to communicate your point. However, when you feel you're getting a little bit more emotional, your breath changes. You're breathing more faster, more shallow, and you are changing your neurotransmitters. So there's a lot of change that is happening behind the scenes, which may not be visible, but certainly if you pay attention and you're more mindful, you will perceive it. You will perceive that you are breathing more shallow, you are talking more fast, and you are maybe engaging less, and sometimes you may be saying things that you really don't mean. So, this is all part of being more mindful and more aware about what you really are doing, and you want to take charge of that moment. This is very, very generic in the sense that this can be applied to a lot of lifestyle, personality, changes and emotional things. This can be applied by a lot of people, including family. You could share this. But here you want to do self-care. You want to establish yourself first. If you are able to make these slow changes, the loved ones around you will notice over time. They will appreciate, they will give you your space, and they will even be more willing to do those changes as well. So breath work is important. Taking a deep breath. So we could even practice it right now. I am not able to see your gallery per se, but when you all of you who are here at this time, or to all the audience that will watch this on YouTube or at a later time, I want you to take a deep breath right now. So let's all take a deep breath. Just deep breathing, and then hold on. And then exhale like a double exhalation. This time we're going to breathe from the nose. So deep breath in, hold it, and double exhalation. Let's do it one more time. Doing this, you are giving a very powerful signal to your body. You're definitely a little more relaxed, a little bit more in charge of yourself, not necessarily of the environment. We're not here to make changes in the environment. That is something that we have to understand. We're not here to change people around. We're not here to change environment or nature. You want to change yourself. It starts with you first. So that's what really breath work will introduce you. And definitely there's more breathing exercises that I share in my holistic center when patients come in. And we work through breathing to really bring about a balance. And I can go into more details about how you can balance, your creative and your judgmental side, your left side of the brain and right side of the brain. It really helps to bring about a more balanced release of neurotransmitters. So this is breath work. Meditation is different. It's a little step further. Meditation means you are shutting off all the sensory stimulation that goes on around you. It's really bringing about more awareness of yourself. So it's a beautiful practice of honoring your own self. And, with time, even if you feel, I'm not sure if I can meditate, I'm not sure if I can sit, or I don't know where to start, you're welcome to learn more things online. I certainly offer meditation classes at my center. You're welcome to follow us on Facebook. I'll share those links, or where you feel a little more comfortable going and learning about it. Even if you feel it's not for you right now, it doesn't really hurt to try. And over time, I'm talking about decades. I'm really talking about over many decades. More and more acknowledgement will come to meditation that we do need sensory detox. We need time away where we're constantly engaging with our senses. And I'm not just referring to social media, I'm referring to even what we're eating, sensory stimulation of we don't have to always eat. if you don't have to always be hearing, then again, it's that time and space you give yourself to honor. However, I do want to focus on our lecture on lupus, and this is something passionate, and I can go on more about it and really help you feel more relaxed with meditation. But I will still stick to lupus and our lifestyle changes, and we'll definitely talk more about this. So, healing the body with balanced nutrition and hydration. So, it's important. Diet is important. It's important to hydrate the body too. And body, physically it's important to be healthy, but not do not necessarily dwell on too much frenetically on different diets or different exercises. We're not here to stress ourselves. That's really counterproductive then. A balanced nutrition, hydration, a regular exercise is very important. So you could start slow, regular exercise by just doing a brisk walk. Now, everybody is on a different spectrum of where they are in their body, mind, and spirit evolution. We are all different. So I'm going to talk about something really small, and you may already be doing marathons, and that is fine. But there are people who might be depressed and might not feel motivation to really exercise. So there are few things that you can do, little cheap things you can do is having a pet that helps you to get out, walk your dog or find a buddy who loves exercise. So we're really about also expanding our social circle with different friends, friends who love to eat healthy, friends who love vegan. So being vegan once in a while is not a bad idea. Gluten-free friends. So you can definitely venture out on lunch, being gluten-free for a day, even if you don't have celiac or you don't have need to be gluten-free. Certainly doesn't hurt to take a break from gluten. So you really want to expand your circle, be more open-minded to interact with people and share their journey, their story. It's really about connection again. So we're talking about connection with everybody. So that really helps us to be more balanced in our nutrition, in our hydration. We want to start getting exercises, walking out, walking with friends who are already doing it. If you are already walking, maybe trying to do a slow jog, a slow run. Maybe setting up a goal this year that I will do a 5K. There's also Arthritis Foundation, and there's different organizations that do walks, to create awareness. So honoring that, just doing small things will help. If you are already like a marathon runner, maybe you need to do different forms of exercises too that are not weight bearing, using a stationary bike, swimming, and then doing restorative yoga to really relax and include all the muscles. So there are different aspects. We don't necessarily want to do only one way of conditioning our body, that this is the diet I'm only going to eat, this is the hydration I'm only going to go around, this is my friend circle, and this is all I do. I always invite people to be more open-minded and really as honor the body through different aspects of healing. There's not necessarily one way of getting there. We all work together. And then rest and sleep to heal the body, preventive health care, self-care. You have to see your doctor. Really, holistic is not about not seeing the doctor or not taking the medication. That's really not a very intelligent way of doing things. A preventative care is really vital. And holistic care is very complementary to taking all your medications. It does go hand in hand with that. And it can also mean that you will lessen your chances of flaring. You will lessen your chances of worsening or progressing your disease. So when we keep that in mind, we really are doing the best to our body. So that's the body aspect. The mind aspect. Mind drives really a lot of what we are. And I have to disclose, I am also trained in Ayurveda and I practice spirituality. And with that, I can tell you that a lot of thoughts come to ourself, maybe over 60,000 thoughts, come to ourselves in a day, and how they impact us. You would not believe, we talk about environment. We can blame, work environment, home environment, so much stress around what's going on in the world. But you have to talk about microenvironment. What thoughts are you entertaining? It's really, let's just talk about ourselves, and let's be in that mode where we're giving more understanding to people around us, giving more love. Yes, they may not, their thoughts may not align with us, and that's all right. That's all right. But we have to make sure what thoughts we are entertaining. So you have to have a charge and control over the mind. And sometimes with lupus, it's a challenge. With having lupus itself, you know, going through anxiety, panic attacks, depression, mood changes, um, any person can go through that. And having lupus is certainly, you're adding extra burden. So now you are definitely, you know, at a place where you have a higher risk of getting all these symptoms. So, very important to practice healing the mind. And this is what I really stress to my patients and at my center. We do offer mindfulness, we offer meditation, positive affirmations. What you're talking to yourself, have you ever even, thought you may be saying, oh, this person doesn't like me. This person doesn't care for me. I don't know if I'm really looking good. Do you know what you are affirming? Don't affirm that. Say, I'm beautiful. I'm really good. I am going to give understanding to my neighbor, to the next person, my coworker, my family member, my child. They may not listen to me. They may not understand my perspective. That is all right. I'm still going to give them love and understanding. And I am whole. I am complete. I'm going to take charge of my body. You want to say that a few times too. This is affirmations, what you're telling your body. These silent whispers do a lot more than what externally happens. It's important to keep that in mind. And you may not necessarily hear this as part of lupus, and not necessarily that I'm going to address this when I see a patient with lupus. No, certainly we follow all the ACR guidelines and EULAR guidelines, and we tell them this is what you have and this is where you are, how we're monitoring your disease. But this is, a step further. When we want to heal somebody holistically, we want them to be part of this journey, to take charge of your health. And, don't be discouraged if you're not doing any of this or you don't think you'll be able to do this. And that is totally fine. It is just to expose you to a different aspect of healing. You may get there maybe next year. You may get there maybe in 10 years. That is totally fine. I just want to share with you, there's a lot that you can be doing and taking charge of your body and your health. Lifelong learning and curiosity is very important for healthy minds. We cannot say that, oh, it's done. I'm done. I'm over, or this is it. No, that's not it. So healing the soul. A spiritual connection is very important. It gives purpose to your life. Certainly, I can share you my example. It gives purpose to me. If I had to do just rheumatology, I would certainly not be doing it. When I was in my training, I had big time rotations in Veterans Hospital. I would enjoy talking to the veterans, learning about their journey, where they were deployed, how their life was, how it impacted them. I enjoyed those conversations. And what I would see with patients is that I put them on a certain medication, but they're also seeing a cardiologist and they're on a blood thinner and their arms are black and blue with all these blood draws. And then they're seeing an infection doctor and they're on antibiotics and now their liver numbers are going up. I would see like it's a big maze that patients are going from one specialist to the other. And I wanted to put the whole perspective together. I wanted to put this all together and tell them there's more we can do. And there's sometimes less that we have to do. And honor their wishes too. As long as, we share evidence-based care with them and help them make informed decisions. So I certainly am passionate about spirituality, spiritual fitness, spiritual health, and without that passion, I really wouldn't be going on in medicine. So for me, this is my passion. This is what I like to do. I strongly encourage everybody to explore your passion, your hobby, and see how you can, find a balance with your work, family responsibilities to also nurture your soul, your purpose of life. You are all very special. All of us are very, very vital. That's why we are here. And so connection with nature is a very important aspect of spirituality. Growing herb gardens, doing having your own little herb garden where you can grow a few things and use them in your food, in your herbal teas. It's beautiful. I've shared a few, talks with patients. I've done a few TV shows where I've talked about herbal teas and things that you can do yourself. This is, I think, very beautiful way of honoring nature and yourself. Spiritual practices and prayer. I personally often do faith-based prayers with my patients with what's important for them. And I think that's a wonderful way of healing. And I strongly believe in faith and prayer. Faith can move mountains. So prayers are important. Make them as a part of your healing journey. Whatever is important to you, you should believe in that. Then, give, do acts of kindness and gratitude, service to the community, what you can do to help someone feel better, what you can do for them. It goes even beyond to help you. So those are very important things about healing the soul. Creative expression, again, what's important to you, your hobbies, things that make you feel like you have a purpose. Art, music, dance, they're all forms of therapies. So do nurture them. That's part of your healing. Now, getting back a little bit more into the diet, diet is important. You want to eat good, and that really helps you feel good. Your diet does it back to your mind too. And it's important to include lots of vegetables in your diet, whole foods, omega-3s, and then spices do affect the gut flora, the gut microbiome. So you are, I'm sure, all very familiar with ginger, turmeric, black pepper, all of those spices, cinnamon, adding all of those, even seasonal things to do are important. And another aspect of eating healthy is to visit your local farmers market. I I do strongly support that, and I do encourage my patients to visit and connect with your farmers, and get seasonal produce. Here in California, we're very blessed to have like seasonal produce in all the seasons. There's always fresh vegetables, fresh fruits. And even now, more pretty much all over the country now, we are seeing more and more farmers markets and, community co-ops where people and community can participate more in getting more healthier produce. So using, whole foods is a good idea. And then using a lot more fruits to add antioxidants in your diet is a great idea. Making sure you are getting berries in your diet. So all the beautiful colors, the more the colors, the more antioxidants and the more anti-inflammatory foods. So they are all very healthy and really wonderful way to include in your diet, including walnuts, flax, and all the nuts. And we do live in the bread basket, the nut basket, the raisin city. We have in California, we're blessed with that. So definitely do take advantage. And reduce foods that are more processed. Reduce foods that have excess sugars. So using more raw food is or more plant-based food is healthy. And again, I do encourage you to also include gluten-free. Being vegan once a month, if you've never done vegan, maybe start with just once a month. Once a month, you're gluten-free. So definitely exploring those, it decreases the stress on the gut. And gut is full of your immune cells. Your immune contact happens at the level of the gut mucosa. So we are exposing a lot of immune cells to what we eat. So definitely we want to make sure we're eating healthy. Now, you don't necessarily need to be really, getting stressed up about following a particular diet. No, that doesn't necessarily need to be the case. I think more balanced approach is ideal. Something that's really not talked so much about in diet books is how you eat. How you eat, where you eat also impacts. You may be eating really healthy, but if you're just on the go, having it in the car, a smoothie, and you're thinking, okay, I'm doing a hike and I just had my smoothie and that's my meal. Not necessarily, the best thing to do. You want to give some time. You want to honor, eating as a very, very spiritual practice. So, I tell my patients that eating is your way of honoring your body because food is medicine, right? So you don't want to rush. You want to sit down comfortably in a nice environment and enjoy your meal. It shouldn't be TV meal. You don't want to have heated conversations either. So you want to give that space and time that you are really enjoying and taking time to appreciate the meal and having lighthearted conversations. So that's just a little more, aspect of diet. And then gut health is important. It's really important that when it's time, or if you are symptomatic, you establish with a gastroenterologist and you do seek, get your colonoscopy, endoscopy, and all the good stuff. You want to make sure that there is no gut inflammation. And sometimes autoimmune conditions can go hand in hand. For example, there could be Crohn's disease and lupus. There could be ulcerative colitis, or may not be inflammatory bowel disease. Maybe there is irritable bowel syndrome, or there may be celiac disease, or something else, that's going on. And other autoimmune conditions also affect gut health. So at some point, you will also need to establish with a gastroenterologist, and you should, really try to focus on different, you know, um, aspects of spices to include also, in Ayurveda, we talk about including 6 or 7 tastes and spices that can bring about those. So we don't necessarily just focus on sweet, salty, and sour, which is kind of more heavily, Americanized diet. Sometimes it's very heavy on being salty, sweet, and sour. You want to include bitter, astringent, pungent, all those tastes too, to bring about a balance in gut health. For example, turmeric is very bitter, it has astringent effect. So that is why we include that in our diet. It's a different aspect. So that's just to give you an example, but I definitely do gut health workshops. That's how I had started my holistic center. And I did lay a lot of stress on eating healthy and, going plant-based also. And so that all helps with what we call our microbiome. Believe it or not, there's more of these friendly bacteria in on us and in us than really us. It's really they are the boss. They're really running the show. So 30 trillion, that's a lot of bacteria. And they are supposed to be friendly unless we are not paying attention and exposing our gut to a lot of stress where we can tip off that balance and you get more unhealthy bacteria. And so you might have heard terms like SIBO, this bowel infection. So, IBS, all those things can happen when that gut flora gets altered and that balance is tipped off. So lots of these friendly bacteria, let's use them as our allies, as our friends to feel healthy. And gut health can affect our mind. It definitely affects our immune system. We know that at least 75% of immune cells are in the gut. So they are exposed to what you put inside your body. So again, that also helps explore a relationship of being healthy and, mindful of what you eat. Now, a little bit more in relevant times, there's a lot of GLP-1 analogs you might have heard, might be doing it yourself or your family members. I do see a lot of patients doing GLP-1 analogs like medications like semaglutides and different variations of them to help with weight loss or diabetes management. So those are again also they also work on getting balance in satiety and really decreasing cravings also. But you can also do that yourself mindfully. And sometimes we're not paying attention and we do eat and then we feel we actually didn't need to. And so really being mindful, and that is a lifestyle change. It does not happen overnight, so don't be discouraged. That is not gonna something that's gonna happen very quickly. That is a lifestyle intervention. That is again changing personality, changing our attitude, how we view food as. So and that all comes again, all those changes are possible if you're not doing it pharmaceutical way, is mind body medicine. Then you're taking charge of your mind, your soul. So you're making that spiritual connection, and you are taking charge through meditation and breath work. All of those things help you become mindful more quickly. So then when you're eating, oh, wait a minute, I need to pause, and then you are a little bit more in charge of gut health. But again, okay, so a lot of serotonin affects our mood, and 90% of it is produced in the gut. We want those healthy bacteria. We really want those. So probiotics and prebiotics are a wonderful way of introducing, all those healthy bacteria in the body. And yes, there are supplements that you will see in the market that you can do, and that is all fine. And I definitely do recommend things like yogurt. Yogurt is nature's best probiotic, and you can make it yourself. So that is another beautiful way of adding probiotic benefit to your gut. Your diet and lifestyle, there's a lot of data that is published in gastro journals and even in general, in other journals also, that how our diet and lifestyle will impact the gut bacteria and vice versa. And then the gut bacteria, there's a lot of them. We just talked about that. Then they take charge and they affect your mood and they tell you what you need to crave and what you not need to eat. And that's when, we are wanting to disrupt that balance. We want to be in charge and we want our gut to be healthy. And so making yogurt is a beautiful way of adding probiotic benefit to your health, to your gut. And a few years ago, I was doing cooking show, on our local TV station, and I shared how you can make yogurt yourself at home every day, very easy. And this video is online on YouTube, and on our YouTube channel, you can follow. I'm happy to share just a little bit, taking in charge of the time. Let's see if I can. I don't think we can play it here. Okay. I think what you can do is go online on the Moksha Holistic YouTube channel, and you will have access to different YouTube videos. There is YouTube videos about how to make golden milk with turmeric. And I have shown patients how to grow turmeric too. I grow my own turmeric spice. In California, it is totally possible. So I've shared that with patients too. Then using turmeric in your diet, turmeric as golden milk, or you can make a herbal tea out of it. That is all great for inflammation. And I even went on with my children and, wanting to make it a little more exciting. We made turmeric ice cream, golden ice spice. So we've done a lot of different things with spices. You are welcome to check it all out at Moksha Holistic Center YouTube channel. And I will keep moving on. And this is just a little glimpse I wanted to share to you so that I'm not all talking. And you can see this is one of my patients who had lupus, and she had this red butterfly malar rash, and she was in healthcare field. So it was very, very disturbing for her to be told all the time that you don't look like you're healthy, you have this rash, are you sure you're doing okay? And she felt very, very awkward at workplace. And then COVID happened, and so you were able to wear a mask, and so she continued wearing masks to hide the malar rash, which got her to a long time. And the rash would definitely go away with moderate to high doses of prednisone. And she kept doing that despite having osteoporosis or thin bones and did not want to do biologics due to all other side effects. She could not tolerate the biologic therapy. And so prednisone was her only friend. And she, of course, did not like the side effects. And at some point, she said to me, I would like to try integrative and holistic approach and change my lifestyle and change the way I eat. And, we worked through that and we definitely used turmeric. Turmeric was one of the big things. And aloe, all of those things for her skin. And this is the other picture. As you can see her, she's on no prednisone at all. She's not using any prednisone, and now her skin has been clear. She's happy. And so I just wanted to give you a little perspective that yes, integrative medicine does work. And but again, I do want to tell you that don't be in that mindset that I'm gonna do just integrative and not take my medications and not see my rheumatologist. I've never, really advocated for that, and that is not a very smart way of doing it. You want to work with your physician, you want to work with your specialist, and then also try other, lifestyle interventions that can help minimize your doses for medications. So just to share a little perspective, and there are definitely more examples, um, but I will still keep continuing in interest of time. So I do want to share with you that please include fruits in your diet. They're rich in antioxidants and for those of us, who are in California, definitely take advantage of seasonal fruits. And then also, even in the whole country, seasonal wise, whatever fruits are available, definitely do take them. They are nature's best friends. And enjoying them. And if you're not somebody who is not really a fruit person, you can cheat a little bit, add a little honey, maybe make a smoothie, maybe add a little whipped cream if you're giving it even to your children, because you really want to get started somewhere and include the fruits. So definitely. And vegetables. I encourage you to go to farmers markets and get seasonal vegetables. You can make stir fries, you can make soup, you can add them. They definitely have prebiotic, probiotic benefits. Broccoli, cabbage, the mustard family, lots of, anti-carcinogenic. So again, lots of benefits. Definitely include them in your diet. The beans, these are, vegetarian sources and vegan sources of protein. So if you want to add a more vegetarian source of protein, consider beans. You can make soups with them. You definitely can add them to your diet. So do experiment with them. Do them, once a month to start with. If you're doing that, maybe go to once a week. So, get yourself where you're including other sources of healthy protein. And then again, different, grains. If you want to try going gluten-free, that is totally fine too. And maybe trying gluten-free once a month is not a bad idea at all. It does give your gut some rest. The food around us, is to some extent, especially gluten, over the years and decades, it has been genetically modified. So it's nice to give your gut some rest. Okay, and I talked, I shared to you about routine also. And, you have probably heard about circadian mechanisms or circadian rhythms, about how your hypothalamus is like a little clock, and how, depending on the sunlight, it changes the various neurotransmitters and hormones that are being released in the body, right from cortisol. So all of that goes hand in hand with um, following a regular routine. So I stress that to my patients a lot, that, in integrative aspect of it is you have to follow a regular routine. It sounds very easy, right? Oh, yes, it's easy, but you want to follow it through the weekend too. So you want to always wake up at the same time. You want to go to bed at the same time. Now, once in a while, you can cheat if you're up late night, but even on the weekends, it's really nice if you can follow a routine. And based on, I can tell you about Ayurveda, we say that after 10, it's a pitta time. So that's the time when body tends to wake up a little bit more. And so you might, if you stay up after 10, you might notice you get hungry more. Then you want to snack more. So, just we want to get to our sleep. We want to be in bed by 8:30 or 9 and read something and not watch, devices. The blue light affects melatonin release, and that can really impact your sleep schedule. I actually gave a talk about sleep not too long ago, and I was very surprised that nearly everybody from people in their late 20s to people in their 70s, it was a whole spectrum. Sleep was a challenge for everybody across, not necessarily related anything to the age, and not necessarily related to having any autoimmune condition, but sleep was a big challenge. So getting to sleep, having a good quality sleep, feeling rested the next day was certainly seen across all age groups. So, sounds very simple, but I will tell you one step is to get into a routine, waking up the same time, sleeping the same time. And I'm going to extend this a little bit more. Your meal times should also be same. Like you want to eat your dinner 6, 7 o'clock. You want to have lunch, not at 3 p.m., stick to the noon by 1. So there you want to follow a routine. That way, you're telling your body that I am, going to digest at the same time. Your body knows I'm going to release all these digestive enzymes. This is going to be lunch, and you may already be salivating. You'll see, okay, it's getting close to noon. So your tummy will start telling you, okay, this is our lunchtime. So, those things this is how you empower your body naturally, where you're not dependent on pharmaceuticals. And so this is, complementary integrative way of working in harmony with your body. Avoid an irregular, rushed lifestyle, irregular routine. For those of you whose work involves travel, this is going to be challenging. If you have work that requires you to take a flight, every so often, then this might be a little bit challenge with change in time zones. Um, and those of you who can take charge should definitely avoid an irregular routine. Okay, so I want to check that with our moderators that we're still keeping on time, and I can still continue a few more minutes then. But if you feel like we need to stop, please do interrupt me.
Please feel free to continue, Dr. Mittal.
Okay, wonderful. So exercise, I do get this question asked a lot, like, can I hike? Can I still continue to run a marathon? Or what kind of exercises should I do? Physical activity is really important. It's important to continue moving. That helps to strengthen your muscles and your joints. Because if you lose muscle strength and muscle mass, it will have a greater impact on the joint then. Then the joint will have to do more heavy lifting. Um, the muscles play a big role. This is a part of your musculoskeletal training and health, that ligaments, tendons, muscles, they all support and work with the joint in doing our movements. So we definitely want to have good strength, good physical activity, and it depends on what your comfort level is. So we don't want to follow no pain, no gain. No, we're not pushing our body. You know what works best for you. And so you want to make sure you are doing some form of aerobic activity. You can start as low intensity aerobic activity all days a week, all 7 days a week for 30 minutes. Now, this could be simple aerobic, just a simple brisk walk. So that in nature, I really prefer, if possible, in nature than running on a treadmill. I think when you do it in nature, it has a little more benefit on your mind. And so, if possible, try to include that in nature. So, doing hiking trails, a simple brisk walk is good to start. If you are already doing that, yes, a jog is definitely good. And if you're somebody who runs marathons, yes, if you are able to do that, please do it. However, you want to also give rest to the joints. For example, if you already have arthritis in your joints, you want to just not do marathons. That's a lot of stress and weight-bearing activity. You want to balance it with some non-weight bearing activities, isometric exercises for muscle strengthening. Less weights. They're also good for osteoporosis, for bone health. So maybe doing, especially for women, you may want to just start off with 10, 15-pound weights, and that's it. If you want to do a little bit more, that is fine. Work your way muscle strengthening, water aerobic exercises. They're really helpful, swimming. Then using a stationary bike or going biking. So we want to include different muscles. Yoga is a great way to include different aspects of your muscles, and you can start off with a very basic yoga class. You could do a restorative yoga, or if somebody is more involved with it, you can do a more hot yoga, or a more flow and more intense workout. Those are all very great ways to exercise. And sometimes it's nice to have a team, friends that you can go out and do the exercise with, or your pet. So whatever motivates you, that's a good way to get yourself some exercise. This is just, to show you that how yoga can actually help with different muscles and joints. And certainly, when you are in a yoga class, and if most of you have already tried it, the instructors will tell you that you can do a modified pose. If you're not able to do this, just whatever works best for you. And that's the beautiful part of it, is that you can do as much as you want and as less as you want, but it certainly helps you to move all the muscles and joints. Some other classes that are beneficial are Tai Chi. Tai Chi is also very helpful. They're very slow, rhythmic movements that definitely do allow you to move different muscles. So I encourage you to try a beginner class if you've never done that. Then other aspect of mind-body medicine is to socialize, to connect with family, with friends, and with loved ones, or with just, if you don't have too much family members close by, with a friend or a buddy that you enjoy with. And if you don't even think that you have so many people there to connect, well, you can, be of service, volunteer your time in a lupus support group or anything that's important to you. So different ways of serving and socializing. This is all very beneficial for our health. So, just a nutshell, when we practice mind-body health, we are definitely decreasing stress in the body. And this helps to decrease our flares. This helps to, when you're in a stressful situation, be it physical, say you're doing a lot of workout, or you have to do it because of work, or due to a certain situation, you're moving, there's a lot of stress. Stress can be mental, emotional, physical, all aspects of stress can definitely help have you get a flare. But knowing that you have some tools to manage that stress will make that flare less. The impact will be less on the body. So regular routine, gentle yoga, breath work, meditation, all of that is important. Meditation helps you shut down, I will tell you again, all the sensory input that you're getting. And the sensory input that you get is most of the times negative, or at least in our mind, we perceive mostly negative things and highlight it and make a picture. We're getting that through our phones, through the hearing, what we hear around, everywhere what we see. So it's important to shut all of that noise and just be there. And if any of you are interested, yes, you could definitely look at some of the videos that we have online at our YouTube channel. Some of you who are close by and can come, you are welcome to come. We offer complimentary and free classes for breath work and for meditation. We also offer for children. I have been offering free breathwork classes and meditation, especially for anxiety. And so you're welcome to try out classes and somewhere close by where you are. I do encourage you to do that. A calmer mind is definitely a calmer immune system. So, nutshell, it's also especially in pertaining to lupus, sun protection is important. It's important to, protect yourself from UV radiation, which can definitely trigger lupus flares. Sometimes it can cause migraine headaches. It can cause you to feel fatigued. It can cause you to feel wiped out. It can cause even kidney flare-ups. So UV radiation can have different aspects on lupus health. So keep in mind, I encourage my patients to always, we are in sunny California, and one way is your smartphones can tell you when UV radiations are high. Typically, after 6 p.m., the UV radiation is minimized to zero, and so you can still do a lot of outdoor activity and not have to worry much about UV radiation. And so you can track that on your smart devices. There is on the weather app, it does tell you about the UV radiation. So keeping sunscreen handy, keeping a hat in the car always is a good idea. And then I also tell my patients that if you have to be outdoors, maybe take little breaks to not be sitting at a baseball game the whole time. Maybe taking a little break, going inside, reapplying the sunscreen. And definitely if your work is involves you to be outdoors the whole time, you might have to explore some changes there because UV radiation can have impact on lupus flares. So that is also important to remember. But in general, make sure you're getting good sleep, you're moving, and you're following all the mind-body aspects, and then seeing your rheumatologist, seeing your providers, and doing all preventative care also is all part of your healing and all part of good self-care that you're doing. And remember, healing is a continuous journey. When the mind is calm and the body is strong, the soul is nourished, you will be able to achieve harmony and balance. So, thank you everyone for listening to this talk, and I wish you very well in your healing journey. And I wish all the lupus warriors take charge. And yeah, you are more than that, and you are, capable of having a great quality of life and having good family, work, life balance. So, good luck to everybody. You can definitely learn more on these websites that I am sharing. So, I wish the very best to all of you and thank you for your patient listening. I'm very happy to hear your thoughts or answer any questions that you may have. Thank you very much.
Thank you, Dr. Mittal, for such a comprehensive and integrative presentation. We really appreciate your time and your expertise. Thank you. So let's go ahead and open it up. If anyone has any additional questions, you can put them in the Q&A or you can put them in the chat. We'll open up that portion now, and we'll go ahead and start with the questions that were asked during the presentation. Please feel free to ask any additional questions while we are talking, and we'll do our best to get through as many questions as we can live and email you answers to any questions that we're not able to get to today. So we have about 15 minutes for our questions. The first question, Dr. Mittal, is if someone is interested in starting a meditation practice, where do you recommend that they start?
Very, very good question. Meditation practice, it's important that you find a space in your home. You make a sacred space. Usually, I will tell my patients that if you are going to start meditation, you should make a sacred space for yourself at home. That is your space where you're going to calm immediately. That's your go-to space where you want to be just yourself. And that space, it's nice to make an altar. You want to have a picture of things that are important to you. It could be an aspect of God. It could be a spiritual aspect, having some incense sticks, some candles, a picture of your loved one, your way to honor nature, God, whatever is important to you, you put in that space. And it could be a really small space in your bedroom, in your study, or in a separate space. Um, if you don't have any space, in your closet, you can find, that little space that's for you. And in that sacred space, you want to sit down for a few minutes every day. You may not know how to meditate. You may not know if you're doing it right or wrong, but you sit there, you have a little altar, you have some incense sticks, you have some fragrance, you have a cushion, you can have a pillow where you sit. If you have children who are wanting to learn this, or moms with young kids with temper tantrums, this is also a go-to space for the child where they feel like, if they feel like they're going through a lot of emotional roller coaster, well, you can tell them, you go and sit there, take your time, and when you come back, we'll talk about it. So, you can use that space for a lot of different things, but that is your space where you can express. You could even journal there. You could even put something there, or just sit there. Close your eyes and just relax and sit there for a few minutes before you go to work, or maybe after you come from work. If you give yourself only 2 minutes even to start and sit there when you get home, you may have thoughts, that's fine. You may have thoughts, oh, this, my coworker didn't do this, or this went really good at work, or what am I going to cook? Or I have a deadline. Let those thoughts come and go. You're just going to just sit there, just look, just enjoy the little fragrance or flowers that you put there, the aspect of God that you have there. Whatever you have there, that's your moment or your accomplishment. You might want to put little notes there, I am beautiful, or a picture of you and your mom, or whatever is important to you. You honor that. Your beautiful picture at a beach, that was important to you. Your childhood memory, you honor that aspect. You would just enjoy that. That is a good start, I think, for you. You get an idea about what meditation is. It's that creation of that sacred space. And it's always helpful to do it externally. This is how I start off with my patients. Now you're eventually, when you're a little bit more advanced at it, you can meditate anywhere. It's nice to have it more peaceful, but yes, you can meditate anywhere. You can shut down that chaos and do it. But that's really how you want to picturize and start yourself. You start off with that sacred space, giving yourself a few minutes, and then jumping. Say if you come home at 5:30, you spend 2, 3 minutes there, then you go off preparing your dinner, or doing things that you have to do to get started. This is a great way to start. And then if you really want to learn, there's a lot of online apps. Maybe your friend or your loved one really likes something you want to try. By all means, go ahead and try that. And otherwise, you can always, check our YouTube channel. There are some videos, and I would be happy to add more to someone who's going to start meditation. So that's just a nutshell of how you want to start.
It's lovely. I like that, of setting up the space, creating the environment for the meditation to take place. Thank you for that. Our next question asks, is there a particular type of diet that you recommend for patients with lupus who have kidney involvement?
Yes, this is a great question. Kidney involvement with lupus, there's actually a lot of data published too about this. Um, Having a plant-based diet and having more vegetarian sources of protein is easier on the kidney. I would definitely try a vegan diet, like I had mentioned. You might want to try vegan diet once a week. I am never a big believer of being very frenetic about following very strictly that, I have to be a certain diet. If I fall through this, oh my gosh, I'm going to die or something bad's going to happen. No, I don't think, and I always believe in making gradual changes. So, there is to answer your question, like, is there a diet that will cure things? No. You have to understand that, you know, so I view things a little bit different, getting a little more spiritual aspect. I am very confident in a decade or two, you will see a lot of published data in our journals, medical journals, and in Western medicine that it's not just diet. It's what you think, the thoughts. So what you see, what you put in your mind, either through social media or scrolling or affirming yourself, all of that has to be digested by the body. All of those thoughts will affect your mood and that'll affect your flare and your disease and your health. So that is why I tell you that there is not one diet, that you may be following this one magical diet and we cannot cure, because that's not just it. The mind affects how we feel too. So that is why, pat yourself on the back. Big relief. You don't necessarily have to crazily follow one diet. However, following, using vegetarian sources of protein, cutting back red meat will definitely be helpful for immune system and for the kidney health. So, following being vegan once a week, using vegetarian sources of proteins, and using maybe lean proteins, no red meat. That will definitely help your kidneys and in general your immune health.
And one of the attendees here is asking, proteins such as meat, like that comes from red meat, is it the kidney's job to filter? So is that meat being filtered through the kidneys and making it difficult for the kidneys to do the work that they need to do?
Yes, red meat is also very stressful for immune system when you expose it to the gut microbiome. It alters the gut microbiome. There is a lot that is published in gastro journals that a diet which is more heavier on red meat can cause more flares of Crohn's disease, more flare-ups of IBS, irritable bowel syndrome. So, even talking about kidney, it does affect the gut health. You really want to cut back on the red meat. So if you are somebody who is doing red meat every day, or it's a very staple part, you might want to do it every other day. That is a big achievement. That's going to change the gut microbiome. And so you're not taking it every day. That's why it's important to include fresh fruits. When you start having more fresh fruits, and if you're not somebody who finds it easy to eat them, then I do a little bit. I tell my patients to start slow, maybe add a little honey, make a smoothie, add whipped cream, whatever gets you to just get started. You want to enjoy more fruit-based diets too, because that'll balance the immune health and decrease cravings for red meat. So your goal should be, if you're doing it every day, make it every other day. If you're somebody doing it maybe 3 times a week, cut back to once a week. So if you can cut back to once a week, that is a big, big achievement. That's not small. So you want to make those changes in taking how much red meat you take. Definitely a diet lighter or even without red meat can decrease inflammation and flares in the body.
Wonderful. Thank you. And we have one last question for you, that comes from another attendee. How do we navigate lupus when it's in conjunction with other autoimmune diseases?
Yeah, that is a very, very wonderful question. Believe it or not, yes, autoimmune diseases go hand in hand. And we do see multiple autoimmune diseases in one individual. That is very much possible. And it gets a little tricky. How do you balance and what do you balance? I do have patients with lupus. We call that lupus, rheumatoid arthritis, and lupus. Then there's lupus and Crohn's disease, lupus and Hashimoto's or autoimmune thyroid conditions. There's celiac disease going on, type 1 diabetes that can coexist. There's something also called Sjogren's disease. They go hand in hand. So definitely there can be different multiple autoimmune conditions going on. And you are very right. How do you navigate them? Here's what I do for my patients. I It's very important to be informed. So I usually educate my patients. You want to get yourself educated. So American College of Rheumatology website has a lot of information available about different autoimmune condition and patient language. So there's patient education section which tells you about different autoimmune conditions. There is other support organizations like Lupus Foundation. There's Arthritis Foundation. You can get yourself more informed, more educated about autoimmune diseases. That is your aspect of educating yourself. And then usually what I see in my practice is if a patient has different autoimmune conditions, usually autoimmunity is strong in their family. And usually, I have seen it more common in if somebody has different ethnicities too. For example, Native Indians, Hispanic ethnicity. If there's multiple ethnicities, there are more higher chances. This is what personally I have seen in my practice. There's more likely to get different multiple autoimmune conditions. However, what I also see is that if somebody, say, has lupus and another condition, the body tends to go in one direction. For example, if there's rheumatoid arthritis and lupus, I have personally, what I have seen is that body is not confused. It's not like you are getting bad rheumatoid deformities and then you're getting lupus nephritis. No, what I see is body tends to favor one autoimmune condition. So even though somebody has rheumatoid markers and lupus markers, the body may just go the rheumatoid route. The hands may they may get the arthritis flares that are more characteristic of rheumatoid, and they usually don't get lupus manifestations, or vice versa. The body tends to go more lupus route. I personally don't see them getting more rheumatoid conditions. So this is what personally I have seen. And then you have to, as a practitioner and as your provider, your specialist, they can definitely give you medications that don't flare lupus. There are certain rheumatoid medications that are biologics like TNF alpha inhibitors that can actually worsen lupus. Now, it's not a complete no-no to use in those conditions, but we always keep that in the back of the mind that there is a chance that here we can flare lupus. So either let's avoid them or be very cautious and mindfully monitor the patient very, very regularly that we're not making their lupus symptoms flare. So certainly it's important for the practitioner to know because we can fine tune your medication. There are certain medications that will not flare lupus, but treat rheumatoid or treat Sjogren's disease. So we want to be more mindful as a practitioner that we're using those medications. And then again, what your aspect as a patient is to be more educated, to be more informed about your health conditions, have a really good relationship with your provider, learn what you can do. Well, the beautiful thing is the lifestyle interventions that I shared, like I said, can be done across the board for all autoimmune conditions. So you certainly can still do these lifestyle interventions and still, keep mind body in balance.
Dr. Mittal, thank you so much for your presentation. We really appreciate your time and your expertise. Please feel free to follow Dr. Mittal on her Facebook page or her YouTube or connect with her for more great resources. Thank you so much. And lastly, before you go, I'd like to remind everyone that if you haven't already, you can subscribe to the California Lupus Foundation newsletter. It's free, and by signing up, you'll receive the latest news, updates on our programs, and helpful resources for people living with lupus. Just visit www.californialupus.org to stay connected, stay informed, and support our mission to raise awareness and provide vital resources to the lupus community. I hope you all have a great day today. Thank you for joining us and have a wonderful weekend. Bye-bye.
Yeah.
Thank you.